need to move ahead. Our next talk will be on epilepsy care challenges and solutions in Pakistan. It will be delivered by Professor Dr. Muhammad Wasay, who is the professor of neurology from Aga Khan University and also the president of NAR Pakistan. I will request Professor Dr. Muhammad Wasay to start his talk.
Thank you, Dr. Malik, for introduction. Please share my slides. So this is, I think, one of the very important topics related to epilepsy. Most of the talks we have heard, they are related to scientific management and clinical management of epilepsy. I think this, in this topic, which I will cover briefly, that how this epilepsy is affecting the overall society and what can we do collectively as a society to control this burden of epilepsy in countries. So please put it on the slide show and go to the next slide. Now, burden of neurological diseases is pretty high across the globe, as you can see from this slide. This is a WHO slide in which is showing that burden of neurological diseases is higher than TB, HIV, cancer, heart disease, respiratory disease, and digestive disease as far as disability is concerned. Next slide, please. Now, out of all neurological diseases, epilepsy contribute about 7.9% in terms of disability. So epilepsy is a pretty disabling problem across the globe, including Pakistan. Probably it's more disabling in Pakistan. Next slide, please. Now, the burden related to epilepsy is high. There are about 65 million patients in the world which are known patients, about 2.4 million patients in Pakistan. Our prevalence is 9.99 per 1,000 people. This population-based study was done about 20 years ago. So it may be different or it may have increased over a period of time, but that's the most recent data we have. It's more common in children, 14.6 per 1,000 children. It has very high mortality. It's more common in younger than 30 years. And it's more common in rural areas. So this is the data related to epilepsy Pakistan. Next slide, please. Now, as far as treatment is concerned, it's more than 25 medications are available in Pakistan related to treatment of epilepsy. There are first-line treatments and new generation treatments, even third-generation treatments are available too. And they cost from 50 rupees per month to even 10,000 rupees per month. So this is the spectrum of medications available in Pakistan. Surgical treatment is also available at one center, which is AKU in Pakistan. Most of the new anti-epileptic drugs are not available in government hospitals. So they are usually out-of-pocket expenditure from the patients and their families' pocket. We have a huge treatment gap in Pakistan. Treatment gap means patients who are diagnosed with epilepsy are not getting treatment. We don't have the exact figure, but it's probably more than 50%. So a large number of patients do not get treatment or not on anti-epileptic treatment. Next slide, please. Most of the time, diagnosis for epilepsy is clinical. So history and family's history is pretty good to make a diagnosis. We have to rule out other causes of seizures like blood test, MRI, EEG, which is done, but it's not done on most of the epileptic patients. We have to get history of alcohol and drug abuse. Pseudo seizures are not uncommon cause of epilepsy or seizures in Pakistan. A number of patients have pseudo seizures and sometimes they are misdiagnosed as epilepsy, are treated for seizures for a very long time. Next slide, please. The main issue related to epilepsy is myths related to epilepsy. That's why it's a taboo to have epilepsy. So there's an issue of jinn or a sab, a junoon. A lot of people don't think this is a disease, like it's a treatable disease. A lot of think that this is a psychiatric illness or it's kind of malingering. A number of people believe that it's not a treatable condition. And a lot of people still believe that patients with epilepsy, they cannot do anything. So they cannot get education, job, or family life. And a lot of things, a lot of time people believe that this epilepsy is something shameful and something to hide. So all of this above contributes to underdiagnosis and undertreatment and high disability among among epilepsy patients. Next slide, please. What are the causes of epilepsy in Pakistan? There is not much data. Next slide, please. Exact data, but we think that 70% of epilepsy is idiopathic. Can you move the slide to next slide? Yeah. 30% is probably related to like some cause. One of the common causes of epilepsy in Pakistan are traumatic brain injury, infections, stroke, tumors, and 5% are probably related to genetic. So these 30% could be prevented. And this is something, if you want to reduce the burden of epilepsy in Pakistan, we have to reduce the burden of traumatic brain injury, CNS infections, and stroke. Next slide, please. Treatment pattern, as I told you, that 70% patients are not treated. Only 35% patients in urban and 8% in rural are treated. 50% who take medications, they are not properly treated for the right kind of medication. And 70% epilepsy can be controlled with one anti-epileptic medication. So it's a very treatable disease. If you diagnose epilepsy right and you treat with the like one medication, you can control 70% of the epileptic seizures. Next slide, please. The problem in our community related to epilepsy is, next slide, lack of awareness among public and misperceptions related to epilepsy. Next slide, please. Lack of awareness among physicians is a problem. Affordability of medicine is a problem, especially it's a problem in the rural areas. And I think one major problem is lack of neurologists in the country. So there's like one neurologist for 10,000 epileptic patients. And that's why most of the epileptic patients do not get the quality care which they are supposed to get from a neurological point of view. And that's why I think it's very important that we should train the general practitioners and family physicians. So what epileptic can do, I think they can do everything if they are treated and if they are well treated. So they can get education, they can get married, they can do job, they can play. There are many sports, men and women who have epilepsy and they are doing very well. They can raise a family, they can do social work, they can go to politics. So this is a message which has to be promoted. Now, epilepsy in women, I think, is the biggest problem. 90% of epilepsy in women is untreated, and mostly is related to stigma and taboo. Epilepsy and pregnancy is the issue. A lot of women do not take anti-epileptic medications during pregnancy, and that's what causes the high mortality among epileptics. And in the neonates, the risk of defects in children is not very high. But a lot of women are worried about it, and there's a lot of misconception about it. A lot of people have no information related to breastfeeding in epilepsy, and a lot of people still think that this is a communicable disease. So that's why a lot of these women, they are not treated and they are unable to socialize in the community. Epilepsy in children is also a problem. Very few pediatric neurologists in country. So there are less than 10 pediatric neurologists in country. And 90% of epilepsy is seen by general practitioners and epilepsy. So that's why awareness is very low among general practitioners and pediatricians related to epilepsy treatment, medication, dosages and side effects. And this is something our society has to work on, and which we are working to train general practitioners and pediatricians relating to epilepsy in children. Next slide, please. A public awareness campaign, I think, is going to be very important, and that's one of the functions of neurology awareness in research foundations. We have done a lot of TV programs. We have prepared DVDs. We always celebrate World Purple Day and World Epilepsy Day, and we are working with the patients to start patient support groups to improve our public awareness campaign. Next slide, please. I think physicians training is also another very important area. Dr. Fawzia has long been running epilepsy mini fellowship for many years. We do CMEs, and we have trained, like Pakistan Society of Neurology has trained more than 1,000 physicians in 20 cities in last year, and we are going to do again this year. We have published national guidelines, which was published in Pakistan Journal of Neurological Sciences, and available for all general practitioners and family physicians. Next slide, please. Role of government is, I think, very important for epilepsy care. Awareness and media campaign is very important. One of the important thing is availability of anti-epileptic drugs at district and civil hospitals. And this is one thing which we have asked government to provide, like these health cards with availability of medications to all epileptic patients. Availability of neurologists and diagnostics at DHQ and civil hospitals is important. I think at some point we have to train our lady health visitors and LHVs and LHWs for epilepsy diagnosis and care. And the government should also support research and training related to epilepsy care in Pakistan. Next slide, please. We need a multidisciplinary care in Pakistan to improve epilepsy care in Pakistan. Next slide, please. And that is going to be, we should get patients, doctors, nurses, psychologists, social workers, media, and we should work together to improve awareness, advocacy, and availability of medications at DHQ hospitals. So in conclusion, next slide, burden of epilepsy is very high in Pakistan, and it's becoming bigger because we have a lot of risk factors which can lead to epilepsy, and epilepsy care is extremely suboptimal. So awareness among doctors and patients is low, and I think we need to work in a multidisciplinary approach. So we have to train doctors, community health workers, and the government at the same time to improve epilepsy care. And one of the very important aspect of epilepsy care is cost and availability of medications. This is a very common problem that epilepsy medications go out of market, and patients are looking for medications all around the country in the pharmacy. So this is something the government has to make sure, a drug regulatory authority has to make sure that all the drugs, they are available all the time with a reasonable cost, and they have to be provided at subsidized cost for the underprivileged. So I think this is my last slide, and hopefully we are able to work together. I'm grateful that Dr. Malik has organized this session, and hopefully we will be able to educate our doctors and our community, media, and the government for improved epilepsy care in Pakistan. Thank you very much.
Thank you very much, sir, for your nice and very timely talk.